Thank you for joining us. Our briefing will begin in 30 seconds. Am I good?
He has a piece of paper.
Thank you for joining us for today's briefing with Secretary of Education, Noe Ortega, and Secretary of Health, Dr. Rachel Levine. Secretary Ortega, let's turn it over to you.
Thank you and good morning. Thank you everyone for joining us today. Before the school year started, the Departments of Education and Health provided school leaders with recommendations on instructional models. These recommendations were based on levels of community transmission of COVID-19 in their counties, as well in accordance with local conditions and factors, such things as size, makeup of a school community, resources available to the school, and whether or not they can provide remote instruction. We know that educators and families recognize that students benefit from being physically in their classroom. Research has also taught us that this is especially true for our youngest learners, those from elementary school age. As we encourage schools to consider returning to some form of in-person instruction, provided that they meet all the other mitigation conditions, today PDE, with empirical insight and support from the Department of Health, CDC, and others, is updating its recommendations and guidelines to schools. Beginning in the second semester, which typically begins around January 25th, and as local conditions permit, schools are going to be encouraged to allow for elementary school students to return back to campus, along with other targeted populations. We know that school leaders continue to be the ones best positioned to make decisions about in-person instructions. So we want to emphasize that while these are not mandatory, it is up to school leaders to make a decision on whether or not local factors permit them to return elementary students to in-person instruction if it's feasible within the context and conditions of the county and community. All pre-K to 12 schools should continue to have strategies in place that limit the number of people in classrooms, that limit the number of people in learning spaces, including teachers and students, and that have rules governing interactions between students and teachers as well. Further, schools should have protocols for distance in the classrooms of at least 6 feet, and make sure that they can continue to maintain this distance to the extent feasible throughout the day. Additionally, considering returning school-age children to school, leaders should consider resuming in-person instruction for targeted populations as well. For instance, among these targeted populations, this could include students with disabilities, English learners, regardless of the general instruction model the school is using. Again, today's recommendations are not a mandate. They are an option for schools to consider as they continue to navigate the pandemic related to challenges in their school communities. Our educators, school staff, and communities continue to do a tremendous job in ensuring that students and families are served during this time. While there are hopeful signs about inroads with this pandemic, there are still real challenges ahead, and we must continue to strive to provide equitable educating opportunities for our students. COVID-19 continues to change the way we live day to day, including how we teach and learn, and I'm proud of the way that schools and communities have responded to students, to providing learning opportunities for students and their families as well. Together, our communities will continue to meet these challenges and prepare for the day all students and staff can safely resume to in-person instruction and we can safely resume more normal and routine operations. I now turn this over to Secretary of Health, Dr. Rachel Levine, who has a few additional remarks. Thank you.
Thank you, Secretary Ortega. As Secretary Ortega noted, the educational benefits of in-person learning, especially for younger children, are very clear from an educational perspective. As a pediatrician, I am also aware of the critical role that schools play in the healthy emotional and physical development of children. The public health research on offering in-person instruction during COVID-19 continues to emerge. We know that it is impossible to eliminate the risk of disease transmission entirely within a school setting when community spread is present. However, recent studies have shown that when mitigation efforts, which are very important, such as masking, hand hygiene, and physical distancing is followed, it may be better for younger children, particularly elementary grade students, to return to in-person instruction. While people of any age can contract COVID-19, research suggests that people aged 18 and under do have a lower risk of severe outcomes. This does include lower rates of hospitalization and death resulting from COVID-19 infection. Additionally, emerging research from the Journal of the American Medical Association for Pediatrics suggests that children younger than 10 to 14 years of age do have a lower chance of COVID-19 infection than adults. As a reminder, the recommendations in this guidance, which have been in place since the beginning of the school year last August, rely upon two standard public health metrics: the incidence rate, which is the number of new cases per 100,000, as well as the percent positivity of diagnostic testing. These metrics are available for every county in Pennsylvania on our early warning monitoring system dashboard. It is important to remember that there are still cases that do occur in our communities, even among 5 to 18-year-old school-age group. Through the end of December, we have seen a total of 52,917 total cases of COVID-19 among the 5 to 18-year-old age group. A large number of these cases occurred between the months of October and December. In October, we had 10,167 cases among 5 to 18-year-olds. In December, we had 52,917 total cases in that age group. This data shows why it is imperative that we take proper steps to slow the spread and continue to adjust our plans as the scope of the pandemic changes, both within and outside the school setting. The critical point to remember is we all play a part in stopping the spread of COVID-19 in our communities. And the number of cases that we're going to see among children in schools very much depends upon that community spread. So each of us have a part to play. We need people to stand united and continue to wear a mask, wash your hands frequently, social distance, avoid gatherings, and stay home whenever possible. In addition, we are asking people to download the COVID Alert PA app. Thank you. And now Secretary Ortega and I are pleased to answer your questions.
Thank you, Secretary. Our first question is from Sam Zern from PLS. Sam, go ahead and unmute.
Good morning, y'all. So with events like the new highly transmissible strain of COVID-19 showing up in Pennsylvania, substantial community spread in many parts of the state, will the department, either education or DOH, be doing any more than just counting the age group case counts? Are we going to see any sort of dashboard for school level outbreaks or anything like that to kind of get a better sense of what's actually happening in schools where COVID might happen?
Well, we don't plan to have a specific school setting dashboard, but of course we have the dashboard that has the number by counties and also does have the age range. Now, as you said, we did report one case of the UK COVID variant in Pennsylvania, and that was travel related from outside the country. But we'll be watching that very, very closely, and as things change, we might need to change our recommendations. But this is not unexpected that we would see cases of the variant, and I believe about 50 cases have been seen in the United States. We're going to be watching that with, of course, the CDC very carefully.
Next up is Tyler Pratt with WLVR News. Go ahead, Tyler.
Hi, good morning. My question is for Secretary Levine. Dr. Levine, early in the pandemic, we saw coronavirus show up in Pennsylvania earlier than in some states, and here we have a new variant also showing up early again. What factors lead to it showing up in the state, say, earlier than others?
You know, I think that it has not necessarily shown up that much earlier than others. We just happen to be able to detect that first case. Dr. Fauci has said nationally, we expect the UK variant to show up in all states. The key is doing the surveillance, the genetic surveillance of the COVID-19 virus that is necessary to detect this. And so we are sending samples on a regular basis from our lab in Exton, as well as other laboratories in Pennsylvania, to the CDC for this genetic analysis. And then we will be working on developing the protocols to actually do that genetic analysis right here in our lab in Exton. And we anticipate that we will be seeing these cases of the UK variant in any state in the United States.
Next up is Flora Pastorera with Penn Watch. Flora, go ahead and unmute.
Hi, good morning. I have two questions for both secretaries. I'd like to start with Secretary Ortega. Secretary, you talked about elementary students. What about middle school students, high school students, and college students? What's the recommendation for those three groups?
Sure. Currently, our recommendations, and I appreciate the question, currently our recommendations exclusively apply to elementary school students, and then, of course, targeted populations that would be determined by the school leaders at the respective schools. And those targeted populations could fall into grade levels that are beyond elementary, right? That would be your middle, junior, and secondary schools as well. Again, we continue to work closely with the Department of Health, monitor research that comes out nationally to figure out what might be some of the next steps as we continue to think about the path forward with regards to resuming in-person instruction among all our grade levels. But at the moment, the current new order is primarily focused on the elementary schools.
All right, and for the Secretary of Health, Secretary, can you provide more details about this COVID variant case? And does the current vaccine work against this variant?
So this variant is sometimes called the UK variant or called the B117 variant. This is the same genetic variant that has been seen in Colorado, California, Florida, and in other states. We detect it by doing genetic analysis or sending to the CDC or other laboratories for genetic analysis of samples. This individual was a traveler. I can't really give you that much more information. We don't give a lot of detailed information about specific patients, but it was a travel-related case. It was not a community spread case. And of course, we do all the case investigations and contact tracing. And as I emphasize, this is really not surprising. Dr. Fauci has been talking about this nationally now for a week or more. We expect to see the variant. We expect to see some more cases of the variant in Pennsylvania and the United States. There is no evidence at this time that it is, for instance, the dominant strain in any part of the United States, but of course, nationally, we'll be watching for that. The vaccine experts anticipate that there would be no difficulty with the vaccine producing an immune response that would be able to prevent this strain. So those tests will be ongoing by the vaccine manufacturers, but there's every reason to think that the vaccine will prevent this strain, the UK variant B117.
Next up is Deanna Durante from NBC 10. Deanna, go ahead and unmute.
Good morning. I actually have a question for each one of you. Secretary Levine, I'll start with you. Yesterday in Montgomery County, they opened up their first mass vaccine site, which we believe to be one of the first in the Collier County areas here. And Dr. Valer-Kush told us that the county had asked for 5,000 doses of the vaccine. They got about half of that. She says right now they can do about 800 vaccinations a day. If they have more vaccine because of the infrastructure they set up, they could do 1,000 or more, which would then help get schools open and businesses open, especially since they're not, she says, just limiting those vaccines to Montgomery County residents. It's people who live and or work there. Given that infrastructure, any plans to increase for counties like Montgomery that can set this up and get this going to give them more than the half or at least the maximum of what they're asking for?
Sure. So we are in discussions with Dr. Arkush and other county municipal health departments that will be setting up vaccination clinics, and we'll do the best we can to be able to meet their requests. What I have to emphasize is that it doesn't mean we get more from the federal government in Operation Warp Speed. So there is a specific amount of vaccine that Pennsylvania gets. Now, of course, there's the Pfizer vaccine and the Moderna, but those numbers we get from Operation Warp Speed, and we have a number of different missions that we're trying to accomplish right now within Phase 1A. We're trying to vaccinate healthcare workers, and so that the vaccine is going primarily to hospitals to accomplish that, as well as federally qualified health centers and our county municipal health department partners. We have asked that hospitals last week, we actually ordered that at least 10% of the vaccine be used for healthcare workers that are not necessarily part of their hospital or health system. The vaccine clinics that Dr. Arkush is running are a great way to be able for those healthcare workers to be vaccinated in that area, and we want to support her. The other mission, of course, is the long-term care mission right now with Walgreens and CVS, vaccinating patients and staff in nursing homes. So we're going to balance that, and we want to accommodate everybody who wants more vaccine, but there's a finite number of vaccine that we get every week. We can't ask for more. It doesn't change. So we're trying to balance those allocations.
And Secretary Ortiz, one thing that I hear in covering the school situation locally is there's been frustration about its guidance, it's not mandates, and it's leaving the superintendents up to doing and the school boards to making these tough decisions. As you're speaking, talking about bringing in younger children, what about those districts that already have the kids hybrid? Are you suggesting that they get them back in 5 days a week or leaving things alone? Can you be a little bit more specific as to what this non-order means for districts that are still trying to operate on a partial in-person basis?
Sure. And so, the entire time, the department, as we've worked with the Department of Health to reconcile sort of federal recommendations along with what we're learning at the state level as well, has continued to make sure that we exercise that local control is important in making decisions about how you're going to resume instruction. So first and foremost, a lot of the deliberating and decision-making happens at that level because we recognize that there isn't a one-size-fits-all policy that we can put in place in order to mitigate and contain the transmission of COVID-19. We encourage schools to consider returning elementary school students to hybrid learning as the local conditions allow. And this is what we're coming out with regards to this new recommendation. And consider all the factors, right? Understanding that to bring students back, as Department of Health Secretary Levine and other folks have said, you've got to create the right conditions. You've got to be able to allow for social distancing to occur, for other protocols that go beyond hygiene, personal hygiene, that include cleaning and disinfecting of schools, as well as other things that have been ordered in Pennsylvania, like face coverings and face masks for young learners. And so there's a lot that's entailed in making those decisions. But we also understand, as many educators have continued to advocate for, that the ability to provide in-person learning in a safe environment is extremely important. And so we're doing that. We've also recognized, and again, I want to emphasize the importance of this order is primarily encouraging schools to bring back elementary students. We also recognize that there are other targeted populations affected. And so we've also created a pathway or a path for folks to begin to provide those learners with some provision as well of learning in order to ensure continuity of learning for young learners.
Next up is E.C. Olmhens from Spotlight PA. Go ahead, E.C.
Hi, Dr. Levine. Thanks for taking a question. Mine is about the vaccine. I know that the state's rolling out the program for nursing homes that aren't opted into the CDC program and those that aren't within the 75-mile radius that qualifies them for that. How many nursing homes is that, and in what ways is that rollout different from that of the CDC program?
Sure. So we did have a number of different nursing homes that opted out of the CVS and Walgreens program. Actually, the majority of those we actually convinced to opt back into the program, because this is really a set federal program and it is by far the fastest way to get vaccines to the patients and staff in nursing homes. There are some other nursing homes that are still either outside the range or have still opted out, and we'll be working with other stakeholders, perhaps other pharmacies, et cetera, to make sure that they get vaccinated as well. I don't have the specific number at my fingertips. The majority, actually, we convinced to opt back in.
Wonderful. And a follow-up question, how can we know how many vaccines have been distributed by county? So looking at the online tracker, we've got information on who's received the vaccine by the recipient's county of residence, but is there a way to kind of find out, the allotment per county and how many vaccines within that county have been used? Is my question making sense?
Yes, I understand. We don't have the ability to do that. Remember, the allotments are being done by the CDC and Operation Warp Speed. For example, particularly for this Walgreens CVS long-term care mission, they determine specifically where they're going to go every week when they get their allotment from the federal government. So we have no way of putting that out on a website.
Next up is Wallace Mckelvey from Penn Live. Wallace, give me 1 second, please. Go ahead and unmute.
Okay. Good morning. Thank you for the time. My question is for Secretary Ortega. One thing that I'm hearing is there's a lot of inconsistency in how districts are actually carrying out these guidelines, and that in some cases the districts are not notifying their staff when there are positive cases and playing some kind of creative math with, when someone is positive, that person may not actually be recorded or that information may not be shared. From your vantage point, what kind of enforcement are you doing to ensure that these guidelines are being followed across the state?
Sure. Happy to answer this, and Secretary Levine, feel free to chime in if you want to add anything on the enforcement aspect. So, we continue to work closely with the Department of Health with regards to making sure that our school leaders and our schools understand the proper protocols for communicating local transmissions, both up to either their local public health officials or to follow the protocols that have been put in place by the Department of Health. Now, all along, it's been very important that everything that we've asked schools to do, including their public health and safety plans, there was a component of it that really required for there to be constant and accurate communication between them and the folks that they serve. Now, it's difficult, given the number of school districts within Pennsylvania, to be able to put our finger on the pulse of each one of those individual schools and how they're conducting, but we continue to offer opportunities for them to elevate concerns as they emerge, whether it's a parent, a family member, a support system, an educator themselves working at the school, to begin to elevate those concerns, and we do what we can to make sure that we can follow up and address them accordingly. Secretary Levine, I'm not sure if there's anything else you'd like to add on the enforcement aspect.
No, Secretary, I think you covered it completely.
One follow-up question for you. How much should the safety of adults who work in a school setting, factor into these guidelines, and what are you recommending, for adults who work in these settings?
Sure, and I don't want to turn the safety conversation, and I appreciate the question. I don't want to turn the safety conversation into sort of a zero-sum type of idea, because the health and safety of all folks matter tremendously, right? And I appreciate the emphasis placed on the educator, but there's a number of other folks that make up the ecosystem of services at a school that often don't get to talk about that we think is important to elevate, right? These are your staff that do cleaning on campus, that serve students food, that provide them with other services, many of them life-sustaining on the campus. And I think for us, all those matter. What we've done in our guidance all along is we've emphasized the importance of making sure that the outcome for the student is something that everyone holds in high regard. And this is what we're putting in place. We want to make sure that we are not mandating or requiring for everyone to come back to in-person instruction. We're creating a pathway for them to do so, particularly when local conditions allow for it. And one of the things they have to factor in is making sure that they account for the health and safety of all the folks involved in that.
Our last question today is from Sarah Schneider from WESA. Sarah, go ahead and unmute.
Okay, thank you. My question is for Secretary Ortega. I mean, I anticipate that this could be complicated for parents with students in different grade levels.
Yeah.
So do you anticipate also changing guidance to include middle and high school students this school year?
Sure. At the moment, we're focused on rolling out this particular guidance with elementary school students. And then, of course, we're going to continue to monitor and observe what the literature shows, especially what the conditions begin to indicate in order to figure out what some of the next steps forward. I will, in terms of offering up the path of where we would like to head, we would like to begin to move into making sure that we could create the right conditions for school to provide in-person instruction to as many grade levels as possible. And this is why we continue to work closely with the Department of Health, listen to Secretary Levine and their staff with regards to what they're learning, particularly with new variants that are emerging, but also what they're learning at the federal level as well, with regards to insight being provided by CDC and other health experts that are providing guidance and input into this conversation. I do want to acknowledge what you shared with us now, which is this is very complicated. I think oftentimes we understand that within a family unit, there are folks at different grade levels. There are folks who are working at home, folks who are still being required because they are frontline workers to be in the job. And we're trying to be mindful at how our decisions affect the entire sort of ecosystem of where folks live and navigate on a daily basis. And so we are aware of that, and we're doing our best to make sure we maintain some sort of alignment or congruent in what we put out.
Okay, thank you. If I could also ask Dr. Levine, could you comment on the transmission spread within schools across the state? Could you just give us some context for what challenge that has been for schools?
Well, I think it always is going to be a challenge whenever you have people in a setting where there's lots of people together. I think it's critical to have the mitigation measures in place that we have discussed, is that everybody is wearing a mask, that you have everybody washing their hands and using hand sanitizer, that you have people 6 feet away. And so I think it is critical to have those measures in place. To be honest with you, data from the CDC indicates that children are more likely to get COVID-19 from after-school gatherings or after-school extracurricular activities than they are actually physically in the classroom. And so that is, our concern about certain extracurriculars and why it's so important to avoid large and small gatherings of families and children, because that type of really close personal interaction leads to more spread. The point I'd like to emphasize the most is that the incidence of community spread in the area will directly impact the ability for this in-person education. So we all have our part to do.
Thank you so much for joining us for today's press briefing. A copy of this briefing will be available later on pacast.com. Thank you and have a good day.
Thank you.
Reports